Hello, my name is Dina Rabo. I am your chiropractic doctor, and this is our new patient spinal orientation. This is only going to cover about 5 minutes of what to expect on your first few weeks or few adjustments. Most likely you are here because you've had some kind of an injury or you've been under chiropractic care and you're simply here for wellness, which is fantastic and optimal well-being. So chiropractic, we are going to deal and talk with a word called subluxation, which simple terms meaning that your spine is out of alignment that affects your nervous system. Your nervous system is what drives your health. It's the connection of the spinal cord connecting the brain to the tailbone, enhancing how your body talks and communicates and works for you on a day-to-day basis. I'm going to go over just a few ergonomics to start off with, because some of the things that you're doing during the day are either sabotaging what we're trying to attain in here, and we want to make sure we give you the right tools to start with. So the first thing I'm going to be talking about is what kind of a pillow you might be sleeping on. If you are sleeping on more than one pillow, right now we're going to take it down back to just one in the evening. An ergonomic pillow to support the curve of the neck, which if you're a patient of mine, you know right now you do have a curve, and we're probably working on some variant of that to help basically optimize how your body feels and functions all day long. So this is what I recommend. This is basically a Posturepedic pillow. It's memory foam, so it does have some density to it, but it conforms to your neck and your weight of your head. And what's nice is it has the curve here to support the side that the neck is on, and your head goes actually at the top. So this here is basically what I recommend. We sell them in the office. There are multiple neck pillows out there. You can look up other ones, but I really do endorse the ones that have support for that natural curve of the neck that these days most people have lost due to technology and phones, sitting at a desk or standing most of the time, and it's often termed text neck. That can complicate such things as snoring and minimizing the amount of oxygen you're getting at night. So just to demonstrate here, I'm going to come around the front. Ideal posture and sleeping habits are to start on the back, supporting natural alignment of the head, and as you can see, the hump kind of supports that and your head sinks down lower. So ideally you have a pillow under the legs for the knee support, and you have an open airway here. The other benefit to this pillow is it allows you to sleep on your side without creating an impingement here in the neck, where you can sleep any various of ways that people tend to sleep. The also nice thing about this pillow is it does not let you sleep on your stomach, because it has this awkward edge here. So it really makes it hard to sleep on the stomach, which most of us shouldn't be sleeping on the stomach because it affects your breathing and neck torsion as well. So not very comfortable after a night. You're going to thrash around and do your own thing. But as long as you start with the foundations of sleeping on either your back or your side, you're going to be good supporting your neck. Secondly, while I'm here, actually, I'm going to recommend getting out of bed. Same thing. You want to work on ergonomics as far as not just coming up straight in the morning, but you want to actually roll to one side, using your upper body to push yourself up, pillows and arms, and that way you're getting up, less stress on the back. You're not warmed up in the morning, you don't have a lot of blood flow to the lower back, so the last thing you want to do is just basically strain to get up out of bed and use those stomach muscles that aren't conditioned yet. So again, just rolling to your side and then pushing yourself up off of your bed or mattress with the feet at the same time. Sounds basic, but a lot of people don't do that. So that's one way to actually save your spine and help promote what we're doing. One thing we're going to go over is just as we're adjusting you, you may think we are just addressing pain issues in the neck, mid-back or low back. Really what we are facilitating, and this is a little bit of a short mapping, we are basically facilitating how your body is functioning and communicating together. This is just a short map of the spine and the soft tissue being the central spinal cord that basically communicate between the brain and the rest of your body. So notice that during your early stages of adjusting, you may feel a little, I would say, relief, a little more light. You might not be able to describe, you just feel different. That is the response your nervous system is doing as we are adjusting and really facilitating movement and less nerve interference as we are helping you with your specific adjustments, whether it's a cervical adjustment in the neck, a mid-spine or thoracic adjustment, or lower lumbar adjustment. You're facilitating better communication between the brain and the body in those areas, and you sometimes will just feel different. You may notice better sleep. You may notice feeling a little more tired because you're down regulating in a good way, that you're switching switches that have been literally left on due to stress, be it environmental, chemical, emotional, physical, and the body has been able to put up with that for a long time. So what we're doing is essentially peeling back layers and unwinding your nervous system in a way that it's allowed to rest, and that is a good thing. It will be something that will be of a transition, so just pay attention to how you feel. We recommend people get about half of their weight in water in ounces daily. So if you're about a 130-pound person, you should be drinking about 65 ounces of water, and that's going to be just specific to each person, individual, depending on where they're at and what their body weight is. Other things to work on are to basically listen to your body, and if you're tired, go to bed a little bit earlier. That's going to allow you to make better progress. When you're sleeping 7 to 8 hours at night, your body's actually able to, and your nervous system is to repair from the damages done during the day, whether they're minor, repetitious from work or play, what have you, or if they're major, if you've been involved in an accident or a fall or what have you, that your body is going to repair that evening as you are sleeping. That is your autonomic system. Without you even thinking about it, your body is going to be doing the repair. So listen to your body during these first couple of weeks of care. If you have any questions, bring them to my attention or my staff's, and they will let me know. And stay hydrated, pay attention to those sleep habits. Ergonomics, we're going to go over a few more in another video, but we hope you've enjoyed this short session on getting you your road to wellness through chiropractic care. Thank you.